Good morning. How was your day? Boring? How was your day? Please just on your phone. How was your day? Has the video been helpful?
Yes.
I'm so sorry that you have to do that today. Sometimes we make a little bit of sacrifice for a system. Okay? So today, initially we were supposed to have 4 different classes simultaneously, so as to go through at least half of what we are supposed to do. You can keep it down, you can keep your phone down, permitting yourself to be able to write if you need it. So in it, we are supposed to start with community nursing. Since you've been watching the video, that means this class is completely a high level question and answer. Why are we so distracted? This class is a high level communication class between you and I. So community nursing. Someone tell me. What is community nursing? And keep your name tags where I can see them. What is community nursing? Caroline. Tell me. Only home setting. So if I'm taking care of children in school, I'm not doing community nursing.
To the community.
Yes, this is nursing care that is being rendered to the community, be it in school, be it at the industrial site, those that are working on roads or those that are working construction, be it in the community, like in most of our settings when we talk about community nursing, is someone that either goes into the community to give vaccination, lectures on communicable diseases, or enlighten the population about something, or you are working with a patient in the patient's home. This is what community nursing is all about. And we left our hospital-based, clinic-based nursing, and now we are going into the community to actually understand what it is all about. Most of us back home, we really do not have this setting. We don't have it in my home country. Maybe now others are trying to set it up. If not, what we have is hospital-based. You have to go to the hospital. And even to those that actually have nurses taking care of a family member in the house, it's not elaborated and it's not a sector on its own. It's just a nurse looking for it. It's not like a setting like this. Okay? And according to the definition, it says community nursing involves the delivery of nursing care in a community setting, focusing on what? Promotion of health, yes. Prevention of illnesses, correct. Providing care to patients and, sorry,
providing care into the patient and into the community around.
yes, and this is what I'm looking for. And we are promoting, we are preventing, we are providing care, and we are rehabilitating. Is that understood? And we are rehabilitating. And this is what all of it is all about. Now, when you go to be a community nurse, working in the school setting, and at this moment, every patient, every student is healthy and fine, and you are just there to make sure they drink good water, you are there to make sure that you tell them what they should do or what they should not do, you are there to tell them how to eat healthy, you are there to tell them good lifestyle and what they should do or what they should not do, you are there to take vital signs and make sure that the children are safe and healthy in school. What are you doing? At that moment, what will you be doing? You will be promoting health. Now, when you go to prevention of illnesses, same in this school setting, in the hospitals, or with the patient, and you are trying to prevent an occurrence, or you are trying to prevent anybody from injury and all that, you are preventing an illness from occurring. Let's say one student comes to the school with a flu, you decide to send them back home. You are preventing others from getting that disease condition. But we will be mostly focusing with what? Providing care to families or patients in a home setting. This is where we come. Now, if you are for the private, that is for the first office, you will either be working in school, in clinics or hospital, or in the patient's home. But in this office, you are completely going to be working with in the patient's home. Is that understood? No. We equally have what? Community nursing plays a critical role in health delivery by ensuring access to primary care, public health initiatives, and support of chronic disease condition. Most often the patient will go to the hospital, and because there is a whole line, it will be very difficult for them to keep being on that bed for 1 month, or 2 months, or 3 months. And because the government cannot accommodate all these people, they have to make sure they create a room in the patient's house that looks like a hospital room, and now send a nurse to them at home. That is why all our patients are the Catholic patients. Is that understood?
Yes.
If we leave from here and we go forward, they will say the rule of the nursing service, that is PNS. We are nurses working under PNS. Now, that is what? Primary nursing service for HAMA. Is that understood? So, that is the difference we talk about PNS nurses and private nurses. And that is why you have another accommodation from the private nurses. Is that understood? And what is your role as a nurse? We went through this, or we've said that already. What is your role as a nurse under PNS? Tell me, Herbert. What is your role? What will be your role?
Taking care of the patient and within direct contact. I direct to the patient.
This is a one-on-one care, a holistic approach of care. Why in the Philippines, what is the ratio between patients and nurses?
That 1:8, 1:2.
It
Depends.
depends on the policy.
So 7, 8, 9, or 10. Caroline, in Kenya, what is the ratio of nurse to patient?
More than 10.
In my home country, there's no ratio, okay? Because a whole ward with 50 patients has just 2 nurses. Yeah. Has just 2 nurses. A whole hospital has 3 nurses with 1 midwife.
That is in general ward, no? Or emergency.
In the medical surgical. In the medical surgical, we equally receive the emergencies. So the emergency comes, we receive them before we now start the evacuation yourself. Especially if you're working in clinics. Except you're working in the big hospitals that are completely divided. However, you'll see 3 or 4 nurses on duty caring for 60, 50, or 70 patients. Yeah. So if I say I want to do that to be a ratio, it will be crazy. So there's no need putting the ratio to that. You just survive. Don't survive, you come back. So we are playing a critical role in making sure that we do what? We provide, we promote the health of a patient, we prevent them from getting diseases or complications or getting into crisis. We make sure that we manage the chronic condition in case of somebody that is suffering from diabetes, hypertension, sickle cell, anemia. You just managing them to make sure that they are able to live a long and a happy life that is not filled with crisis and going to the hospital each day. And equally, here we are not talking about communicable diseases. We are talking only about non-communicable diseases. Because if you have a communicable diseases, you'll be taken to the center which they manage that, and this will be handed over to the hospital. Already, we know that our scope of practice involves promoting, educating, management of chronic disease conditions, and as nurses, we provide what? Education. When we talk about education for the patient, Lindy, tell me, when we talk about educating the patient, what are some of the topics that you, as a nurse, will be educating your patients on?
Educate about health promotion,
Health promotion, like what?
nutrition, nutrition, diet.
Please, I need you to speak as much as I do.
Health, nutrition. And
Yes,
diet.
nutrition. Go ahead.
Lifestyle, proper hygiene.
Lifestyle, proper hygiene, okay.
And educating them on prevention.
All right, I will take that. Who has something to add?
You know,
Tell me.
like for example, if the patient is diabetic,
Yes.
teach them about the proper diet,
Mm-hmm.
and then how to promote daily exercise.
Correct.
And then if the patient is stroke or suffering from post-stroke, assist them in their activities of daily living, teach them what to do, and especially the diet, ma'am.
Okay, please give them a hand of applause. Clap as though you mean it. Thank you so very much. Now, it is very necessary when you want to break down examples of what you will do is to align it with what disease condition we are talking about. Now, if you tell me about lifestyle, I have an obese patient. What will I do? I will be talking about exercise, I will be talking about dieting, I will be talking about any other thing that I feel that will enhance or help this patient to be able to gain themselves confident and every other thing and be in a healthy way. If I'm talking about diabetes, I should be talking about sugar control, right? And we know that when we are talking about diabetes and type 2 diabetes, if you control their diet correctly, you'll be able to manage that disease condition without necessarily taking medications. But if we are talking about diabetes type 1, which is insulin dependent, then we will be able to control the diabetes itself as nurses, now coming in with the expertise of being a nurse, as well as helping the patient with their diet so as not to aggravate the condition or put them in hypo or worse, decay. Is that understood? Yes. So the lifestyle for you to talk about education as a nurse, we need to know exactly what we are talking about. If I meet a patient that has problems with COPD and the patient is a chronic smoker, I should be looking at how to bring this topic onto the table. Because it's not just about knowing. Sometimes you know, but bringing the conversation together is not something that the patient is willing to give you a chance. Yeah, when they told my grandma to stop smoking, do you know what to stop drinking? Do you know what she said? So all the people that died, is it alcohol that killed them? How do you want to teach that kind of a person? You are not going to be able to teach because the person already has a conception that they are fine with. Now, anything you bring to the table that has anything to do with that particular thing is a no-go area. So sometimes you equally need to know strategies in which you are going to help this patient to accept your teaching and to live by it. Let's say you are talking of a patient that has depression and you need to counsel them. You need to prove to that patient that the patient is undergoing or is suffering from depression. Because half of those patients do not believe that anything is wrong with them. They just have hatred for everybody. And according to them, you are the problem, not them. So how do you now tell them that they are the problem? So you see, and such diagnosis may not be given by the hospital because remember, it's a conservative. Understood? Okay, let's go. When we are talking equally about the home care, we are not just talking about adult care. We are not only talking about geriatric care. Fortunately or unfortunately for us, we don't have a pediatric nurse in class now, but we have two already outside preparing for the exams. So if you, in case you're a pediatric nurse, we equally be looking at prenatal or postnatal, as well as pediatric care, extending to immunization and all this programming, okay? But I don't have any of you in class, so I will go to where we belong. We belong to elderly. This is our specialty. We probably had run away from crying to going to big babies, which was not a bad thing. Now, community nursing service for the elderly focuses on managing chronic disease conditions, and these chronic disease conditions we will be talking about is just so that we help them live a quality life ahead of them. Because if you are taking care of a patient, like my oldest patient is 99. Yeah, it's actually older. 99 years of age. Now, what do you think you can do to this patient? Apart from making the patient comfortable, eat correctly, and do everything that is nice and make sure that they are relaxed and they just living their last moments in the most comfortable, in the most loving, and in the most tender way ever. That is the only thing the person wants. Nothing. Don't give them any story. Not interested. Okay? So when you equally identify your type of patient, you know the best way to coin the lectures, to coin the care, to draw your care plan, suiting that individual. On the other hand, you are going to meet a patient maybe 45, maybe 40, maybe 50. They still have life in them. They still want to live. They still want to explore. They still want to travel, but their health is holding them back. Now, this individual has an open mind. They want to try things. There are times that we'll take a patient and the patient will tell us, I really want to improve my weight. I really want to improve on my dieting. I really want to exercise, like help me move from bed and do something. The patient will tell you, though I have medication, I don't like taking them. And that is why I need you to make sure I take my medication. You think that if a patient really tells us that on the first day, then you call me and say, Mom, my patient has refused to take medication. They told you already. They told you they don't want to take medications. So you already know that this is your number one problem. You are going to be fighting with her every day to take medication. So you must find strategies in which you are going to sweet talk her, you are going to pamper her, you are going to do everything in your powers to make sure she just takes the medication. Because of course she already told you this is my number one problem. I hate medications. Though I have them, I don't like to take them. It means if she's taking insulin, she's not going to take it. How do we manage that? This is a high alert medication. But then you have to find a way out to make sure the patient takes the medication. But the good thing about her is that she has life. She wants to live. She wants to explore. She wants to change. She doesn't just have the will. You are coming in as the will that she needs to change. Unlike somebody that's 100 years, he doesn't care. He just wants to be comfortable. So if the Baba says, just keep my leg, no massage today, keep the leg. That is not part of the plan for that thing. You say, Baba, you need to bathe. You are not interested. You're not going to force Baba to go bathe. You're not going to force her to clean her. No, you just need to pamper her today, and then tomorrow you now give her a little bit of reason why she should bathe, he should bathe, or she should bathe. Keep making them feel comfortable and happy. If you meet a patient that is in their 20s, they will even be more complicated. Or in their 18s going to 20s, now they still have a little bit of stubbornness in them. They still want to prove themselves that they are men. They don't need you. They still want to tell you that they are in control. Not you. You can't control their life. Do you know how much of a headache you're going to get? Ample space of it. Like you're going to be coming by every day with headache. So you are going to identify your patients, and then you're going to know the approach in which you are going to manage this patient. Now from there, we are going to be looking at emergency preparedness. Whether we like it or not, we must be prepared. At all moments, at all times, because for the fact that we are in a home setting, we are not going to be having all the equipment needed for an emergency response. And that is why your competency will equally stress on you identifying the crisis, on you knowing where your powers end, and to identify when it is a need for a bigger or a more bigger team to send in and to send a patient to the hospital. We are going to get scenarios of breathing difficulties, low blood sugar, very extravagant high blood sugar. We are going to have problems with maybe pulmonary edema. Do I still have to stand there and wonder what I want to do? There's nothing I can do. So I need to send the patient to the hospital. And that is where we look at collaboration. Because when you are talking about preparedness, you are talking about how much we as nurses, we are ready to collaborate with others. You can never do it by yourself. Whether you are in the hospital, whether you are in a clinic, whether you are in a home setting, even if you are in the industrial side, that you are the only nurse, you still will not be doing it by yourself. Imagine that there is an accident. You are the only nurse. Will you start running to the 15, 14 and all the people? No, you have to take charge and start appointing those that are healthy enough to help those that are not. And in the home setting, we will know who to call. It is either our patient is under home health care or the patient is not under home health care. Now, if the patient is under home health care, the home health care setting is a whole hospital on its own, with specialties, with doctors, nurses, with wound care specialists, with dental specialists. Everyone is involved. So if the patient is under home care, you just need to call the home care number. You'll be given when the time is right, and you will make the call indicating what is wrong with your patient. If it is just something you need someone to come, check it and go back. But if it's a situation in which it is an emergency, you need to take the patient to the hospital, we will call the 999, which is the emergency number for Qatar. Is that understood? The emergency line is 999. Immediately you dial that number, an ambulance will be sent to you. Every health district, every zone has a standby ambulance that is just standing and waiting for that call. Is that understood?
Yes.
So here you are going to take my email. Here is my email address. For all official communication that you really need to send an email, then you send an email to me. You already have my company number. Here is my private number. In case you cannot reach me on the company number, you certainly can reach me on my private number. Where is your pen? Take it. Now, in our last class, we were told where and when
Classmate, can I you?
There's also a picture of the children sent to the center.
Dali. Wrong. Is that right? That's maybe. Which AIHI? That's me. QA.com. No, ano, Resco.QA.
The QA only, then kulang the
If you're in the medical field, expected handwritten is great. But right,
you cannot read.
you can't read.
You can read this and
You
read.
can read the
It's
handwriting.
Doctor. His handwriting is like a doctor.
It's like a ECG.
No.
Look the same. It's okay. I can manage. Wait. Change position.
Just change the environment. What you do is you
I'm sorry. Touch me. Touch me. And we are so
Time check. 40. One 59.
Oh, it's 7,000.
99. QA.
is academic, right?
I thought
Check
we
no
would
for-
do
for
the
check.
emergency number.
No. Right. One.
It's what it's like. It's different. It's 9.
Oh, yes.
It's 7,000.
Some questions. Spaces that are
You want to examine? Chloronic acid is good for those ones to be.
Sorry. Okay. As we said last week or yesterday, communication ends with or starts with me, either ends with me or ends with whoever is involved. Is that understood? However, when it comes to your accommodation and maintenance, for the ladies, you know who to report to, and for the male, you know who to communicate to, and they know who to communicate. That is the aspect they'll go straight to Maria. Okay. With the family, every report or every end of shift should be with a member of that family. You will have a care partner. A care partner, could be a caregiver or a nurse employed by the family. So even though the government will be sending them a nurse, they will equally have a nurse that is by the family, because it is requested that you work with assistance with someone else. In case you want to carry, you want to turn, or you want to lift, you should be able to do that with an assistant or someone that is present. So the two of you, if you're working just one shift, you are going to be working with that individual. If there are going to be two nurses, the two nurses will be working with that, one of them will be working with that individual, or one of them will be working without the nurse. But still, the nurse is living with the family, so you can always go to call the nurse to come in the moment or in those period in time that we need those services. So if you want to do your handover, make sure the care partner is with you and involve the family always. Let them know exactly what is going on with the patient. And in case you're having any communication with the hospital or any calls, make sure that you keep or you still maintain the decision maker to be the family member, not you. Is that understood? Okay. Hours of service. Now here, you might not understand our hours of service, but it's not much different from what you have had. We either have 12 hours, 14 hours, 8 hours of duty. And there are other hospitals that have 6 hours of duty. Depending, there are people that work per hour, but mostly from my country, I think same from Kenya, you have either a 12 hours by day or an 8 hour by day, or you have an 8 hour by night or 14 hours by night. Because you might either work 12 by day and 14. Because from the time you take over shift, which is 5 p.m., so you are leaving at 8, that is 14 hours a day. Okay? So the services that are offered here are 4 different categories. We have category number 1. It is a 12-on-7 service. A 12-on-7 service means that there are 2 primary nurses, 1 or 2 relievers. 2 primary nurses, 1 or 2 relievers. Who are working for 12 hours and 7 days a week. So the 2 primary nurses will be working 12 hours for 6 days. And the reliever or the relievers will be relieving for 1 of those days. Is that understood? And then we'll leave them, we'll have a 12-on-6 service, a 24-on-6 service. On 6 service. So the first is 24-on-7 and the second is 24-on-6. 24-on-6 means that you're working for 24 hours for 6 days. It means there is 1 day that is off, and that 1 day that you are off, the family is responsible for taking care of that patient. Is that understood? And the 24-on-6 service, there are 2 primary nurses and no reliever. 2 primary nurses with no reliever. We will leave from there and we will be going to a 12-on-7 service. No.
The first one.
And the first one is Zone 7 is Zone 7 to pay primary nursing service.
That's top 7.
Zone 7 to primary nurse or
And one or two days.
and for 6 service, 24
4
hours
hours,
for
6
6
days,
days
and 2 primary.
nursing without overload. The other one,
So, so maybe she.
the other one,
Hindi ko yung first 24/7
24/7.
24 and 7.
The first one,
24 hours for 7 days. May dalawa kang
May
nurse.
no,
May one or two reliever.
Everything
for 12 hours.
24/7 is
Dalawang nurse. One or two relievers.
24/7. Then in 12/7,
So if you're
again,
reliever. But if it's English,
English,
but in 106, there's no reliever. The first one, 24/7.
the first one, the first one is 27.
It's
12/7,
12/6.
we're going to discuss.
Yeah.
That's third one.
But most of the time, even if you have 24/7. Or this one, 24/6.
24/6.
24/6.
Primary nurses, no reliever.
Yeah. There will be times like that.
Family, family will be at 6 hours.
So in the patient, it will be 2 nurses. Changing shift or like.
For some time. Our duty is either 12/7 or so.
Urgency would be 24/7 right now.
Most probably, or 24/6.
And for 6.
Yes.
No reliever.
Because it's just like you're having duty.
Okay, okay, right. Alright, we're sa surgery, right?
Ah,
90, 150. We call the elder, the head of the family. Yeah.
And then for the female,
I don't know. Madam. Yeah. Madam. Madam. Yeah. Head of the family, they call it.
most of the time we have it. So I have to put it in front. Most will take it in front tomorrow, let me know. Okay? And one day. Okay, focus.
Alright, where were we? Tell me, what are the three services that I've mentioned? The three nursing services that I've already mentioned.
24/7, 12/7, and 12/6.
Not yet mentioned.
24/6.
Exactly. So we have already 24 on 7, 24 on 6, 12 on 7, and now we're going on 12 on 6. And for the 12 on 6, it's just one nurse and one reliever, who will be working for 12 hours for 6 days. It means there will be a day that they will not be working. No one will be working. Okay? And on the day that they are not working, the family is responsible in taking care of the patient.
In the 12 and 7, you were able
Not yet,
All right.
12 and 7.
For the 12 on 7, this is one primary nurse and one reliever. One primary nurse and one reliever. And for these people, they are working for 12 hours for 7 days. Is that understood? So this is a shifting. The shifting is a 12-hour shifting for each and every one of you. Accommodation provided and all that. Food might be provided by the family. Might. There are some families that will provide you with food, and there are some families that might not provide you with food. Especially the family where there is just the patient and nobody else.
there are cases where
Yes, where you have just the patient and the caregiver, and then there is probably a maid or a dinner. So you will have to go with your phone. Okay? Where there is a family members or where there are family members taking responsibilities of the patient, you will certainly be provided with food. Is that understood? Okay. Now we are going to be looking at HMC standards of care. Yes, you listen to up to this level. What are the standards of care that we are looking at? Shirley, tell me, Habibi. When you listen to the recorded video, what was the standard of care that you could remember?
Will give overall holistic approach without discrimination and with respect to the patient.
Exactly. Now the approach for the home care nurse is you giving holistic approach. Of course, you have just one patient. So you only one who is in charge in making sure that this patient is okay. Whether the patient needs physiotherapy, whether the patient needs bathing, whether the patient needs the services of whoever, you are in charge. No one is going to be there with you. No one is going to be telling you what to do, what not to do. You are the only one that assess your patient and decide what the patient needs. Because yes, the case manager will always be home, maybe once a month or once in 2 months or once in 3 months. And until then, that they can chip in and say something, you are the one in charge. Is that understood? So you need to take care of the patient holistically without discrimination. Now, because your patient is a patient that is suffering from dementia or depending on where you studied from, you are not going to now not care for the patient. Because your patient is too old and is using diapers, you are not going to neglect the patient. So you are not just going to take care of the patient that can hold you accountable for the errors you do, you are equally going to take care of the patient that cannot hold you accountable by being accountable to whoever is your patient. Is that understood? If you are taking care of a healthy patient or you are taking care of a special need person, you're certainly not going to discriminate on the patient. Is that understood? And equally with respect of all 5 core competency, which is what we are all going to be doing now. We are all going to be learning and learning. We are all going to struggle to understand what the 5 core competency is all about. And Ma'am Patricia is going to start with it. If we go to our next slide, this in collaborations with the policies that we are all here to study. And for the 5 core competency, here we have is physical assessment, yes, We all watched this slide, so give me. What are the 5 core competency you're going to be defending in the simulation work? Tell me, number 1.
Physical assessment.
Physical assessment. Number 2.
Pain management.
Pain management. Number 3.
Communication with ISBA.
Communication with the use of ISBA. Number 4.
Infection control.
Infection control, medication management, and administration. These are the 5 core competencies that we are looking at. And when we are looking at physical assessment, this is the total assessment that you are going to give your patient. Okay? Whether you are taking the approach of ABCs or you are taking the approach of head to toe, you are going to apply this in making sure that your patient is completely fine every day. And then we will look about pain management. Now for the pain management, we are going to start with pain assessment. You are going to assess your patient for pain, then you are going to manage the pain, and then you are going to reassess the pain. Now for everything that you are going to be assessed upon in that room is going to depend on these 5 aspects. Okay. You leave that and we are going to go to communication with the use of ISBA. How do you communicate in a situation where you need to call the ambulance? What do you tell them that makes or that brings the severity of your patient? Remember, you're not the only one calling. Sometimes even when you want to call, they'll tell you that you are in queue. That is because there are a whole lot of people trying to call. So what is that thing that you are going to say that will make them understand? Because they shouldn't ask you, say, my patient is being dizzy. They said, okay, is the patient having diabetes? You said yes. What is the glucose level now? You don't know. I'm needed. Can somebody tell me why? Okay, so you need to know how to communicate, to be able to present the patient's situation correctly, giving background of who you are, who the patient is, the present assessment that you have done, the result of that assessment, the management that you have implemented, the evaluation and the reason why you need a doctor, or the reason why you need an ambulance to take the patient to the hospital immediately. Now, it is very easy when you listen to it because it's like it will just go from one thing to the other. But when you start doing it, it's a whole process, and you start finding it even more difficult to communicate using ISBA. But you will have to learn, and that is why I want you to speak. And when you're speaking, speak with a whole lot of confidence. Because you need to present yourself. You need to stand in front of a jury and say exactly what you want to say. The assessor is not just coming to ask you a question and then you look down and then, no. They don't mind failing you for the 2 times, okay? They don't mind. So you will have to defend who you are and the number of years you've been practicing. Next, when we look at infection control, we'll be talking about the 5 moments of hand hygiene. We'll be talking about the PPE used. We'll be talking about sterile equipment. We'll be talking about means in which you can prevent infection and cross infection. Because as long as you are caring for your patient, you must make sure you are not going to add to their problems. Is that understood? As well as medication management and administration. What are your rights of medication administration? What are the checks that you need to do before you administer medication to the patient? If you have to administer insulin, what are the considerations that you must make, or the other assessment that you must make before you administer insulin? You must be able to manage the medication and you must be able to administer correctly. What is the rules of administration? What is the policy before you administer that particular medication? If I'm administering insulin, I should know that I have to check after the administration. I should be taking consideration on the site. that I'm administering. So when you look at administration, what is the frequency of administration? What is the dosage of administration? These are what we are all talking about. The insulin pen, if the insulin pen has been opened, how long is the life cycle? How long is the life cycle of an insulin pen? 2 years? I'm listening. 20. I'm not getting what you said.
20.
Please clap for her. I just said now, when you are speaking, speak with some confidence. Sometimes, even if you're saying the right thing, if someone do not see the confidence in you, they are going to use that very thing against you. They will just make you confused. So when you're saying it, say it like you know what you're saying. Is that understood? Okay. Now, the 5 core competency holds the key to us being here in Qatar. If you do not study them correctly, if you do not apply them correctly, if you do not go to defend yourself in the knowledge and in the skills that you have, you might not be able to make it. We have had people that have failed 4 times and had to drop off. So you should understand that this holds the key to your being here and to your being in this program. Next, we are looking at what? The chances that you will take competency. Competency chances is just 2. All right, you have those 2 chances. So when you take it the first time, you don't make it, we'll prepare you again for the second time. When you take it the second time and you don't make it, it will be the management to decide. So we'll send you to the other office. So go get decisions from them. Whatever they decide to do with you, you are not more under our care. Is that understood? Take this very important. Make sure that you do your possible best to pass on the first trial. Because when you work hard to pass on the first trial, you are giving yourself 2 chances to make it. The first chance, that one you're already presenting, and the second chance that is coming. But when you don't make it for the first chance, you have just 1 chance, and that chance is the second chance. Is that understood? So the first time, study and do everything in your powers to make sure that you are convincing enough for the assessor to say you are good enough to be a home care nurse. Next, when we're looking at, we already said we have 2 chances. After that, you'll probably be going home, or the management will be giving you something else to do with your time. Now we are looking at the parameters that is needed for you as a home care nurse. The most top priority is confidentiality. Elton, read.
Confidentiality involves protecting personal, sensitive, or private information shared by patients during care and ensuring it is disclosed only to authorized individuals when necessary for treatment, payment, or legal compliance.
Thank you. These are informations that have been provided to you because of a place of privilege. And the place of privilege is the fact that you are the primary nurse to that patient. There are patients that are in the house sick, and the caregiver or the cleaner do not know what the patient is suffering. Because they understand that these people do not have the knowledge that is backed by policies to be able to keep this information with them. But when you start caring for that patient, before you even go to the patient, you have been handed all the patient's medical record. So you know already what is wrong with this patient. We are not just going to listen to what they have to tell us. The hospital is giving you all the medical record of the patient, and you will now go with it. The medications and everything has to do with that patient. So of course, the patient is expecting that everything that is in your keeping is just between you and her and the immediate family that should know. Is that understood? If you breach confidentiality, and it's discovered, you have a possibility of spending some time in jail before going back to your home country. You already know that. We have the next of those principles. It will be respect for patient autonomy. The respect for patient's autonomy. What is autonomy?
Patient have the right to decide for themselves.
Thank you very much. Patient has the right to decide for themselves. Here, everything you do, as I earlier told you yesterday, is that you're going to take consent. You want to bathe them, you take consent. You want to feed them, you take consent. You want to change them, you take consent. Everything that you do, you take consent. And that consent is you giving the patient a chance to be able to take their own decisions. Even if you have to influence that decision at some point in time, like when the patient refuses to bathe, or the patient refuses to eat, or the patient refuses to take medication, but let it be that they started the conversation by first accepting you to do whatever you want to do, or refusing. Don't just come, bring food and say, Mama, you have to eat. No. They will hate you even before you start working. Is that understood? So give them the chance to take their own decision. Now, patient has the right to control the information that is leaving from you to any other person. So if they tell you this person is not permitted to know what I'm suffering from, that is what you're going to respect. Patients have the right to do what? They have the right to access their medication record, except it is against medical advice. So maybe see the patient is suffering from depression, cancer, or something that is severe, and the family do not want that information to be given to the patient. You have to respect that. And if that is the case, the cupboard where you are keeping those documents must be locked with a key that is kept by you. So that she does not just ask another person to check that cupboard and give me what is inside, and then now she knows what they are trying that she should not know. Is that understood? Okay. Yes, my dear.
If the patient is unable to decide for herself, for example, if patient have an insect, right? Insect. If the patient is
Having delirium.
delirium that time and not able to decide whether what is right or wrong, or decide
What to do or what not to do.
yeah.
Yeah.
How about that?
If you are taking care of a patient that is completely vegetative, or you're taking care of a patient that is demented, cannot take decisions on their own, it is still okay to tell the patient that, Mama, I want to bathe you. When you tell the patient you want to bathe her, whether she understands or not, you took permission. Yes. Mama, please, I wish to give you food. Then you wait, then you go bring her food. She will not respond to you, but you actually took permission. Understood? So she must not respond. Many of the old people will not respond. I'm sorry. Focal from illness into my attention, even more than. Yes, I have sent it. I've received from him. The next patient will be E. I just sent you the email that I sent now contain the name for the second patient, not Nawal. Thank you. Okay? So you can still always take permission without necessarily talking to the patient. First, there are many patients that will not be understanding English. But you still talk to the patient regardless. Okay? So because they are not understanding, does not mean that they should not be told what is happening. I said love, care is one language that everyone understands. Whether they know what exactly you're saying, they will understand that what you mean is for good, and they will accept. If they cannot accept, they will just be there, and then you will still decide to change or not to change. Next, we are looking at professional and ethical obligation. You must follow the NAMDA or the American Association of Code of Ethics in making sure that everything that you do is in line with your nursing practice. We already have, before we start working, we know that we must have our licenses, which they are in process for all of you. Now, if there is a problem that you have for licenses, certainly you will not be able to work, because there's no way that you can work without it. You must be able to understand the disease condition that you are caring for. If you are caring for a patient with diabetes, I'm expecting that you know everything about diabetes. If you are caring for a patient with hypertension, I expect that you should know everything about hypertension. And this is going to help you make sure that for every care, for every practice that you are giving is evidence-based. Do not come now and you are giving insulin and they ask you what is the function or the purpose of insulin and you don't know. You come the next day, you're giving paracetamol, they ask you what's the function, you don't know. Why are you giving it? It was indicated PRN. And now you have been giving it morning, day and night, simply because they say PRN 3 times a day. So you need to understand. You need to study your medication list. You need to know how to fill the medication on the medical record form. And you need to see in ways in which those medications help this patient. Interaction. It is either a medication is for a curative purpose, either a medication is for a preventive purpose, or a medication is there to rehabilitate the patient. What do I mean? If a patient already have maybe say a fracture, and the patient is old, and the patient is placed on insulin, and this fracture is already healed, yet the patient is still on insulin, or is still on aspirin. Is the aspirin still used for the purpose that it was used during the time of the injury? No, because during the time of the injury, it was actually for a curative purpose. But now it's no more for a curative purpose, it is for a preventive purpose. If you want to live from here and go to Africa, we have a lot of mosquitoes, right? So the possibility of you having malaria is very high. If you now start taking anti-malarial medication now, is it for a curative purpose? No, it's for a preventive purpose, just so that you'll be able to reinforce your immune system to combat whatever you're going to meet. Is that understood? So you must know the purpose of that medication at that moment. It might be a curative medication, but at that moment, to that patient, it's not a curative, it's a preventive. Is that understood? Information consent. You must take consent at every point before you conduct or you carry out your duties, especially if you have to take that patient to the hospital. Don't just have an emergency, you call the ambulance, and then you take the patient to the hospital. No. If the patient needs to go to the hospital, you must call the decision maker of that family and inform them of the circumstances that you are facing and the need to take the patient to the hospital. Why with the individual helping that patient to go to the hospital? Because whether or not you like it, when you get to the hospital, they will need the decision maker. And then imagine that it is your father. And then they are calling you from the hospital that your father is in the hospital. How will you feel? Very bad, right? So you must take consent at all moments, be it whatsoever. Make sure that the family is aware, make sure that the family is accepting that whatever you're doing is right and they are willing to go with it. Now, best practices. First, secure handling of medical record. You don't keep the medical record in a place where the caregiver is going to clean and see it. And if the locker is that which can be accessible, make sure that you tell her not to clean it, you do the cleaning yourself. And when you tell her that, clean it yourself. Don't tell her I will clean it and then you never clean it. Okay. Next, store physical records in a locked cabinet, which has been explained. We have avoid unauthorized disclosure. You do not go to the kitchen to do handover. Never. You do not do handover in the hallway. You don't do handover in the sitting room. You don't do handover when relatives and visitors are in the patient's room. You don't do handover or you don't talk about the patient in the accommodation. Does it mean that if I find difficulties about the patient, I cannot share it with my roommate? Secondly, if the roommate has something to do with that patient. So if the two of us we are working for the same patient, I can actually come and tell you the difficulties I'm facing in my shift. Now, because you directly have something or can say something that will make my day easier. Okay, I have. What?
Sorry.
Yes,
I also have one question.
yes,
Regarding, you told us that we have to inform the relative before sending to the hospital.
Mm.
How about in the emergency cases, patient having hope?
If the patient is having a crisis now and you need to solve the crisis now, you call the ambulance, right? The ambulance will not just appear in the house. Is that true? The ambulance will take time to get you there.
Yeah, but
Either 5 minutes or 6 minutes or 8 minutes.
and situation is the relative is not around, maybe
The relative does not need to be around. The relative needs to give you authorization.
authorization.
Yes. So after you call the ambulance because it's an emergency, you should be calling the family that this and this and this has happened, and now we need to take mama to the hospital. And they will ask you which hospital, and they will follow you to the hospital. If they are not in the house at that time. Wherever they are, they will leave from there and they will join you in the hospital. And even if they are not coming, they might call somebody else that is free that will join you in the hospital. But you don't do it by yourself. They might call you that you stole the patient.
Sometimes not, because sometimes case to case basis, if the patient, for example, it's an emergency, right? We were going to take care first of the patient before call a medical ambulance. Then after that, that's the time we're going to call
The family.
Yeah.
Okay, now I think something wanted to go off. It was the
If you see something that is kind of
it's
an emergency.
Let me help you with the breakdown. Okay? Now, when you talk about nursing and its intervention, we treat symptoms of the patient, or we relieve our patient from symptoms. And if I find an emergency, the first thing that I do is what? According to your nursing care plan, what do you do first? You assess. And when we talk about assessment, we are looking at subjective, objective, and general assessment. This general assessment could be a head to toe, ABC, or a head to toe. Okay? So this is what you are first going to look at. Now, before you call the doctor, before you call an ambulance, it's because you have assessed this. Because you need to tell the ambulance, all of this information. If you did not do it, the ambulance will drop the call and will ask you to go and do it again. When you are done assessing, what do you do? From your nursing care plan, after assessment, what do you do? Diagnosis. You diagnose. Now, what are you diagnosing? Is it a medical diagnosis or a nursing diagnosis? You are doing nursing diagnosis, and your nursing diagnosis can either be related to whatsoever the disease condition might be. And this nursing diagnosis is going to give you a highlight on what you should be looking at and what you should be solving. When you leave your nursing diagnosis, where do you go?
Plan.
I don't know why none of this seems to work today. You'll be planning. You'll be planning what to do now. I went into the patient's room and I met the patient on the floor. When I arrived there, do I just carry Mama and put back on the bed because I'm strong enough? No. Because Mama might be on the floor with a broken hip or a broken spine or a fracture, an open fracture. Do I just carry her? I can't. I need to assess. This is when I start going to assess, looking at what is wrong and what is not wrong and what is the state of Mama, asking Mama all the questions that I need to ask. Then when I determine what is wrong, there's probably a broken spine. Will I carry Mama from that place? No. I cannot leave the patient from the place. Now this is me already assessing, this is me already diagnosing, and because of my diagnosis, I have made a perfect plan. And the perfect plan is do not touch. But let's say I came and met Mama on the floor. Mama is having dizziness, and she says, no, I did not fall. I actually had dizziness and I came down by myself. And because I know that Mama is already diabetic, I said, okay, Mama, I will lift you to the bed. Because I know my patient is fine. Then I lift her to the bed. Then I check the blood sugar, and the blood sugar was low, or the blood sugar was high. I gave insulin, which is now what? Which is now going to be my interventions, right? When I am done with my interventions, what will I do? I will evaluate. Now I am evaluating the patient to identify if this, what I have solved, has it been resolved? Or what I was trying to intervene, is it still there? It's like pain. So she says, my leg is hurting, my leg is hurting. And then after you give pain medication, the leg is still hurting. Do you think is the problem was that leg? Or maybe after readjusting the leg and keeping the leg in a comfortable position, the leg is still hurting. Was it just the leg? It's not the leg. Something else is the problem. Okay? So when you have actually got to your planification will tell you if this case needs your intervention or this case needs you to call directly in the hospital. So if that situation needs you to call directly in the hospital without going any further, you will call. And when you call, you'll be giving your subjective, objective, your general assessment, whether you are doing ABCs, you're doing head to toe, and then you come to tell them the diagnosis that you think the patient is suffering from. And for the fact that you cannot lift the patient from that floor because you're suspecting maybe there's an open fracture, you certainly can see an open fracture, or maybe there's a fracture on the spine, the hospital will be coming immediately. And they will then do the intervention in the hospital. Anything you do at that moment will put your patient in harm's way. Is that understood? But if it was something that you could solve, then you go ahead and solve interventions, and then you reassess. Maybe now you reassess and you realize that the problem was not solved. That means what you were thinking as a diagnosis is actually not the correct diagnosis. You will come again to start from reassessment until you get again to evaluation, and if it does not work, then you know that this is not something you should be dealing with. I might be wrong somewhere. And of course, it is okay if you have done the assessment to evaluation and then you are back again because it is not working, for you to tell the doctor, I have done this, I have done this, I have done this, and it is not working. Is that understood? Yes.
Ma'am.
Yes, tell me.
How about, for example, you said that patient have fracture, then suddenly, she having a difficulty of breathing. Then, as Aya says, she's having a pulmonary embolism because of the fracture.
Mhm.
Then we all know that pulmonary embolism is fatal, right? That's the time, and for example, what we are going to do for that time, at that time, because we need to immediately send the patient to the hospital because this was a pulmonary embolism, right? How about that case? Because
You're already having a fracture already, you're sending the patient immediately to.
no, yes, ma'am, because it accumulate because fracture can
The moment that
The
you see
moment.
see a
Now,
fracture,
my point is not how you intervene. No, my point is you have identified why you need to send the patient to the hospital immediately.
Yes, ma'am.
No matter the severity, you are sending the patient to the hospital now. So I call the ambulance. When I have called the ambulance, I need to call the family. This is your point. I call the ambulance and I tell the ambulance, this is my emergency, I need to go to the hospital now. The ambulance will be coming and I call the family.
Okay.
Now the family will decide to meet me at home if they are close or if they are around, or they will decide to meet me in the hospital. But the end result is the fact that the patient needs to be in the hospital at that moment, regardless of what the emergency is. As long you know this emergency is what I cannot handle, then I'm sending to the hospital. And you need to make it clear so that the ambulance that is coming understands the emergency and prioritizes your case. If not, they will send you to go and do your reassessment. You understand?
Yes.
And before you make a call again, you'll be in a queue. So you need to make sure that you know what you are saying, so that you avoid going and coming and going and coming and just standing in a queue. If you ever call the hospital and you see the minute that they need to take, just waiting for the next person, you get it. You are number 117. That is when you know that you don't use any opportunities at all. Now, why is this one going off?
Unless it should be something that is useful. That's all.
Off again. Okay, something is wrong here. I have no idea.
Too clinical.
If anything wants to give me headache, I run away. I don't like stress.
Which one?
See?
Again?
Yes. What?
It's okay.
How did it go off?
No, it's the other, but it's okay.
Now, what is this?
Then it will just do that. See. Silent.
This is just too much. Okay, so is that understood? Any questions? Okay. Avoid disclosure of unauthorized documents. You don't give handover in the hallway, in the elevator, in the kitchen, and you don't talk to people that does not consent you in any way. Okay? If you must talk to someone, that person should be the decision maker, should be the nurse that you're working with, or should be the care partner that you're working with. Is that understood? Professional communication. Of course, professional communication is with the use of ISBA. The same ISBA that you're going to apply when you're going to the hospital or when you want to take the patient to the hospital is the same ISBA that you're going to use in communicating with the nurse, making sure that she understands everything that you're trying to say and is able to do the next task that is left undone or the next task that you want her to do. Avoid sharing patient's details on social media. Never share a patient's details on social media. Never take pictures with the patient in the patient's home. Don't do anything that has to do with your uniform and duty on social media. If you are a TikTok addict or you do Telegram or Instagram or whatever the grams are, just make sure that you're not doing it with your uniform and you're not doing it in the patient's home. Is that understood? Okay. Patient's privacy. We need to maintain patient's privacy, of course. Next, disciplinary action. As much as we talk about the things you should do, if you have to violate any of these things, it's going to lead you into taking a disciplinary action. You can lose your job, you can lose your license, you can be terminated, you can go to prison in case of a felony, or you can go to prison before going back home. In case if they think there's still grievance that has to do with the life of the patient, it might end up taking your own life. Being a nurse does not simply mean that you offer care. Being a nurse equally implies that you are struggling to live a happy life and you are struggling to live a free life. Because one little error can take the freedom out of your life and put you in jail. This might not be intentional. This might be an error that can happen with anyone, but you need to be careful and you need to do your duty in such a way that even the family will agree to the fact that that was an error. Is that so? Because whether you like it or not, you make the rooms as clean as this hall, but there are cameras. So whatever you do, they might look at it to be small, but when that problem finally happens, you will know that accumulation of very small things make a very big thing. Is that understood?
Yes, sir.
No use of phones on duty except you are communicating with me, except you are communicating with the family member or the decision maker, except you are communicating with the hospital. On this note, you can use your phone. Except you probably have an emergency at home that you need to attend to. And even with that, I need you to take permission from the family. When I call you, I'll always ask if you're free to communicate. If you are not free, I will leave whatever I have to tell you until you are close. Is that understood? Except it's an emergency that I need to talk to you, then I will ask you to take permission from the family or for whoever is around you and talk with me. Is that understood? If not, phones are not allowed. If you go on duty and spend your time on the phone, know that your days to causing an error will be very high. Referral steps. You need to refer your patient. You need to take your patient to the hospital. You need to take your patient for a specialist. Maybe the patient has problem with their dentures. Maybe the patient has problem with the eye. Maybe the patient has to go now see a dietitian, and you need to do that referral. There are steps in which you must take in doing referral. Is that understood? We'll get to that in details when we get there. First, the first thing that you need to do is identify the need for the referral. What is that particular thing that you need to refer your patient for? Number two, you need to identify the reason. Now, my patient might be diabetic. It does not mean that the patient should go see a nutritionist. But if my patient is diabetic and has high addiction for sugar, then I should be asking the patient to go see a nutritionist. So you might have a need, but the need though is not backed with a reason. Is that understood? My patient might have not very nice teeth, but it does not mean that the patient should go and see a dentist. But if my patient now start having painful swellings or mandibles, then I need to see a dentist. From there, you must identify the need for a specialized care or diagnosis that is going to help you to walk forward. Because if you call the special hospital or the specialist that you want to work with, and they ask you, what exactly do we need to play in this patient's life, and you don't see, they will tell you to call the patient's doctor and let the doctor refer the patient to that specialist. Most often, this is what they will tell you. Now, the patient is having difficulties in opening the eyes, and you think that you can see an ophthalmologist just like that? No. You call the ophthalmologist, and they'll ask you to communicate it with your physician, and let the physician refer the patient to the ophthalmologist. Okay? With the referral now, you just go ahead to present the fact that I have been referred to you. And you must estimate and see the ability of the patient to manage this referral. If their health card can cover that referral, if they have finances, if there's no insurance to cover, if they have finances that they will pay. Because you can make all this arrangement and then they go there, they tell them that the services is say 15,000. Who pay? Who is going to pay the 15,000? Because you are the one doing all these things. It's none of their business. Since you are so generous, maybe you can pay. Right? So you need to tell them, this is the hospital we are going to, this is the amount we use for consultation. After consultation, if you have to do this, this is the amount. The hospital will not tell you, you need to ask them. So don't expect that because you're going there, the hospital will give you a rundown of whatever is going on. You need to send them the health card so that they can identify if that services is being covered by that health card. If it is not, explain it to the family. This will not be covered and this will be covered. Is this understood? Obtain patient's consent, identify appropriate facilities. You need to identify the facilities that you want to use. There's the hospital for adult is Hamad. Hamad is the hospital in which each and every one of you will be working in their private sector. Okay? So the PNS is the primary sector for Hamad. Is that understood? So when you have all the adult patients, you'll be sending directly to Hamad. But for those that will be having babies are going to see them. Is that understood? Prepare medical records for transfer. I will always give you a file that contains all that patient's medical record. It is for you to keep it and keep it well. Because in a need for emergency, you will just carry that file and you go to the hospital. Is that understood? Communication with the receiving facility. You must communicate with the receiving facility, especially when it gets to do with the details of the patient, when it gets to do with the timing, and when you are going to see the specialist. Next, coordinate transportation if needed. If you need to go there with an ambulance, you need to make arrangement and an appointment with an ambulance. So here, an ambulance does not just function when it's an emergency. An ambulance can be booked to transfer your patient from home to the hospital. Is that understood? So if you need the services of an ambulance for transportation services, you tell them I need to go to the hospital this time. You need to be 30 minutes before time because maybe the distance from your house to the Hamad hospital is far. So this is the time that you need to leave and come, and this is the time you need to be in the hospital. That way, there will be an ambulance ready in the front of your house on that day and exact time. Is that understood? But if the family wants to take the patient to the hospital without a need of an ambulance, you need to be sure about the fact. Okay? Follow up. Your follow-up concern has to address certain issues. And number one, was the concern that you send the patient to the hospital addressed? You went to the hospital because your patient is having tooth problem, and you saw a dentist, and then you came back home, and your patient is still having tooth problem. What did you go to the hospital to do? So you need to make sure that problem is solved. I have one of my patient that went to see an ophthalmology because the eyes keep slipping in, so they needed to shift. So if I went without really telling the ophthalmologist that the problem of this patient is not the eye, it's the hairs, they could just open the eye check and then they said, it's okay, okay. Then you go back home. So you must make sure that that particular problem is solved. And after you're back from the hospital, you will need to make an appointment report, okay? And send, we'll get there. We are offloading the materials one after the other, so that you don't have shock from information overload. So lastly, you need to follow up with me. This is why I said you will make an appointment report, telling me why you went to the hospital, what was done in the hospital, and when is the next report. Is that understood?
This is done after you have
You're
returned
back-
from the.
This is done after you're back from the hospital. When you're going to the hospital, you need to inform me that there's an emergency, you are going to the hospital. Okay? But if it is an appointment, I already know that there is an appointment that day because you keep giving me daily report. And on your daily report, I will see what you are having for that day or for the next day. And if you have an appointment, I will know. But if there is an emergency, I will not know. So you need to inform me that it's an emergency, I'm going to the hospital. And then you only give me the report after you're back from the hospital and when you're now dropping the next report. You will include in your report what happened that day. Is that understood? You will be told how to do it. All right. So right up to this moment, we are done with our community, understanding what we are expected to be doing now in the community. Now, knowledge is power. Because without knowledge, there is no power. You can be so brilliant. It's just like if they take you now and put you in the construction site, and then the engineer start telling you something. Now, I don't even know what he will tell you because I don't have anything. I don't know what they do in that site. You will not know, so you just be looking. Does it mean you are dumb? No. You are intelligent, but not intelligent in this field. Okay, in this field you are a blank sheet, white as snow. Okay, so because we are in the health setting, and when we do community nursing in school, they just tell us you will be a community nurse, you go into the quarter, you give vaccine, you do this. Nobody ever gives us a breakdown on what we are expected, what we are not expected to do, how we are expected to relate, what we should do in case of crisis, how we can assess our patient and still be safe and still have the fulfillment of being nurses. There is no difference between being this nurse and being in a clinic. You are in a clinic. The only difference is the fact that in the hospital, we have other doctors, nurses, supervisors, every other person is there to intervene.
Yes.
But here, there is nobody to intervene, only you. And that is why they need nurses with a certain level of clinical practice, with a certain level of understanding, with a certain level of critical thinking and problem-solving skills to be able to do this independently. So you might be a nurse, you might know how to do everything, but we see that your critical thinking does not match what we need in the community. We will just keep you in the hospital to be following doctor's order. Is that understood? So, yes, for the fact that you were all chosen, that means there was something that stepped out of the nursing career. You were a nurse that is capable to think. You are a nurse that is capable to hear a problem and within 1 second, you start solving it. If you do not have those abilities, you will not be here. So you have all what it takes to keep solving a complex situation until the end of time. Is that understood?
Yes, ma'am.
All right. I'm sure we are almost closing the day with, this is 2:47.
Okay, I have a question.
Yes, my dear, ask all the questions you have.
If ever there is something that you see in the patient that is unusual, can you give me like take a picture of it and document and put as a documentation?
Yes. Yes.
Thanks.
You can take an authorized picture. Now, when we are doing the home risk assessment, you'll be doing it with me. Okay? So for each admission, I will be there with you. So do the home risk assessment. And during that time, we will explain what your duties are to the family and what you will not do. You will never do as long as you are there. Okay? And we will tell them and take permission on that day that we are sorry. There might be a situation that can happen and we need to identify exactly what the problem is. And maybe the doctor might request that you take a picture and send. So we are begging the family that if you come in and meet me taking a picture of Baba's leg, I'm not trying to post, I'm not trying to do anything wrong. I'm probably just struggling to send it to the hospital. But I will still say, why doing that? Make sure the family knows what the hospital is requesting. I just called the doctor now and he says he wants to see Baba's foot. So I am pleading, I will be taking a picture of Baba's foot. Of course, they will tell you, go ahead. All right? My request for, my request for you to take a picture of your urine bag. Because maybe you said the urine is not having a good color, it is yellowish, it is this, and she takes the color, let me see it for myself. Of course, you can take a picture of it and use it. That will not mean that you violated anything. Okay? Any other question? Are you curious now to go into the community and work? Tell me.
Just for clarification, if we're going to call 99, we will go into this dial on our
Mobile phones.
mobile phone.
Yes. That is why I say you can use your mobile phone if you are communicating with me, you are calling the hospital, you are calling the emergency, or you are communicating with the family.
Alright.
Okay? Yes.
Other one, ma'am, is regarding our PPE. Are we going to, you're going to provide us?
On your first duty, yes. We are going to provide you with the gloves, we are going to provide you with the hand sanitizer, we are going to provide you with a gown that you're going to use. But when we get there, there are some patients that the hospital is providing them all. So if the hospital is already providing to them, we will no more be providing to you because you'll be using the hospital provided accessories. But if there are no accessories by the hospital, we will always send to you the clothes when needed. Is that understood?
Yes.
Any other question?
How about the scope like that, ma'am? Are we going
No.
to be
No, you will not be given a stethoscope. The family will have all equipment that are needed for you to do a good job. And if they don't have, we will come back and we will request, or we will ask the family to request from the hospital. And if the family, if it takes, it's going to take long, we are going to ask the family to buy. All right? Depending on how much you need it. Is that understood? If you're having a patient with respiratory distress and all that, and you really need a stethoscope, of course, that would be a priority. I'll have to ask the family if the hospital will delay buy. They will buy it and give you. If you're having, let's say, a patient with a diabetes and you need to be checking the blood sugar, and they don't have, they will have to go buy. I need it. How would I work if I don't know the state of the patient? Any other question?
last, ma'am.
Even if it's not the last.
Uh, all our patients are non-communicable, right? Or there's communicable diseases that we.
Non-communicable diseases. Communicable diseases will be in the hospital. Okay? That is not something you can handle. That means the whole team. And you're not a team, you're an individual. Yes, another question. Anything. You can ask me any question at any time. Alright? If you just said and that thing tells you in your head, oh, I needed to ask, just ask. We will always keep verifying you until the day you pass your competency and you start work and you keep asking the questions. Because everything that I'm saying now, I am saying something that is good, but at the end of the day, you are going to take only part of the materials all set together. But when you start practicing, you will now see the gaps that you would have asked questions to solve. And you keep asking the questions and we will keep solving this. As long you ask questions, you will get solutions and answers to those questions. Is that understood? Any other concern?
Any more?
All right. I know that yesterday you did a pre-test for conduct.
Yes, ma'am.
I have not done code of conduct yet because I do not want to do code of conduct in the evening. Okay, I want to do the code of conduct when your brain is still sharp, and that is in the morning. So since I was still delaying because I have my table, I'm still hoping that I was not going to take a class today, so that the other nurse that is joining today will join you. We will take the code of conduct tomorrow. That is not something that she can be out for. So in the morning, we will take the classes. If I'm done tomorrow, good and fine. If I'm not done tomorrow, then we'll have a class again on Saturday because I have just these 4 days. And Saturday will be off. So
Yes.
I'm on my day 3 now, which is my day 2, which is still a half day. Okay? So just make sure that you take care of yourself, finish on the other things, and
Yes, ma'am. Thank you.
you can call it off.
That's good.
You took the care of your estimate to pay.